Hello everyone, sorry, I was a bit muted there. We need to do a bit, Kirit, I think we have to mute. Maybe we have to just yeah, I think you have to unmute. And that's a fantastic start to today's event. Eventually, what happened was that there was this display in the classroom. So we are sitting in the classroom. This is at De Montfort University, Meal Studio. And what we are doing, as part of Manawood service, of course, we are having some of the people from Leicester who have been contributing to Leicester for a long time and have been doing a variety of work actually involving different areas, particularly interested in South Asian communities. And they have been making quite a big impact actually. So today, this afternoon session, I'm going to talk with someone who is quite versatile, looking into different things and has been doing massive work and making a difference to South Asian lives, particularly. So a very warm welcome to Kirit Mistry there. How are you today?
Thank you for having me. Yeah, very good. Thank you. It's nice and hot, but yeah, good.
Nice and hot. A good start to our event as well as a day, I think. We were actually thinking of doing this conversation for a long time, but it's just the timing because we are involved in so many projects. And it would be really lovely to kind of have an idea of the work that you're doing. And thank you for supporting our research initiatives. You have been partnering with us. We've got a mole with you. So altogether it has been fantastic. So would you start by giving us a little bit around the work that you're doing?
Yeah, thank you. So it's good to work with yourself and De Montfort University and all the other partners involved in this Manawood initiative. So as you said, I'm Kirit Mistry. I'm the chair and founder of South Asian Health Action. And we set up this charity 5 years ago, and we were realizing that the South Asian patient voice, carer voice and community voice was missing. So that's why we are a patient carer community-led charity, and our core focus is really around health conditions that affect the South Asian community and really promoting better health choices for our communities once they get the right information, education, engagement, and then need to be empowered. Our 4 core main areas of work is really, we've been involved in organ, blood and stem cell donation awareness because obviously there's a shortage of people from our communities coming forward to donate. So we for our organ donation campaign, we've set up 3 faith campaigns: the Hindu Embrace Organ Donation, Muslims Embrace Organ Donation, and Sikh Embrace Organ Donation campaign. And again, that was really to try and break down some of the religious and cultural taboos around organ donation from a faith perspective. So that's been, we have got a number of community ambassadors who had a transplant or been a donor or sadly lost somebody while waiting for a transplant. So these are our messengers, our advisors, our ambassadors who can really tell their story and share their story, which connects our communities, because this is the challenge within organ donation for us, is that we are more likely to be in need of an organ than be in a position to donate because of the health conditions I mentioned. So our message is loud and clear, is that if we are going to take an organ, then we should be thinking about donating as well. Either while we're living, we could become a living kidney donor. That's another project we work on, living kidney disease, but also deceased donation. And certainly since May 20th of 2020, the organ donation law has changed in the UK. So we are now going to be donors, and unless we don't want to, and then we have to opt out. So that's one of our core areas of work that we do in the community. We've got diabetes awareness, diabetes risk assessors and champions, and then we have a monthly South Asian diabetes support group that, we kind of bring people who have got diabetes, pre-diabetes, their carers, or generally people who want to raise awareness in the community. And that's our monthly support group where we could bring, it's a peer-led group where we bring healthcare professionals and people from not just England, but healthcare professionals we work with in India as well. And that's our diabetes work that we do. Other focus work of ours is around mental health. We've set up a South Asian Mental Health Community Ambassadors. That's through the World Health Organization, MHGAP program. And then we found a partner in India called Yaya Life, and they've produced self-care toolkits for people to manage it better in terms of their anxiety, depression. So we now have training people as well-being ambassadors. So that's really, and as you mentioned earlier, that we're doing a lot of work around research. We were finding that our kind of mission is engagement, education, empowerment, and exploring. The exploring element is about research, because our communities are not getting involved in clinical studies or not getting involved in research. So we are now, for the last 2 years, we've been working with various universities and healthcare organizations to be more involved in getting the patient, carer, community voice from South Asian backgrounds involved in research. And a new project that we have just started, and we were successful with working with our local NHS CCG, or clinical or integrated care system now, what they've been called, and it's called the Core 20+5. It's a new health inequalities NHS England program where we've successfully become one of their partners in the Wave 2, and our focus will be as part of 3 organisations working on the health inequalities program: us, South Asian Health Action, Sharma Women's, and Equality Action. So we are going to be working on really the core 20 is the 2020 higher challenges or needs as identified by the deprivation index. But then the core 5 is the 5 element, is the 5 clinical areas that we're going to be working on. The clinical areas is hypertension, cancer, and respiratory, and then the other 2 is mental health and mental illness and maternity. So we're kind of glad to be working in partnership with our local NHS on this new program, and it's really to address the disparities of those clinical areas which have been existing for many years, and through COVID, that's just further, brought to light the disparities and the lack of inequality. So we're really fortunate to going to be working on this for the next 12 months, and our role will be to engage our communities, find people in the community who have had, challenges with cancer, with hypertension, with respiratory challenges of COVID, and then we can ensure we can get them the right support services, or they can be engaged by the relevant healthcare organisations locally, and hopefully the experience we're doing in Leicester, we're focusing on the South Asian community for this Core 20+5 initiative, but that will hopefully help other populated areas of high South Asian populations within the UK to learn from the work we're going to be doing here locally. And I think our kind of final message is around lived experience. So we thrive on people who've got, like myself, I'm a type 2 diabetic. I was a carer for both of my parents. So our lived experience is what really is important. So all of our projects has an element of lived experience, people involved. And that's kind of why our uniqueness of South Asian Health Action is unique in the sense that we are the lived experience, patient, carer, community voice.
I think, it's a wonderful volume of work actually you've produced, and I have witnessed it as well for the last 2 years, ever since I have got involved, and I know how you have been actually dealing with the digital literacy as well, isn't it? So there was this digital divide, and of course you started training people up on digital devices. Apart from already, the work that you're doing around health action, you have been also looking into more social issues as well. And I think, if I'm not mistaken, you did something on the domestic violence as well, isn't it? There was a talk or something. Yeah, I remember. So, in all of these, what do you think is the most challenging part, like, of getting by in the community? So, is it the organ donation, or is it the mental health, or is it something else?
So thank you for remind me of the work around the mobile applications workshop. Again, that was done locally in partnership with the Jane organization, and again we found a trainer from India who from Gujarat who could then deliver the workshops to get people to be more empowered on how to use their mobile phones, whether it's their Android or iPhone, or whether even the Zoom applications. Because of people were isolated, we needed to try and help them. They've got a device, but they don't know how to use it. So this workshops have been going on for over a year now, and it's been very valuable. We've had over 500 people joining in every Saturday, to kind of look at learning and how to be empowered themselves, so less reliant on their family members. The biggest challenge really is obviously all the projects we've done. We are all volunteers, so we don't have any paid staff. As we get a project, we've got some coordination that we can then get somebody to deliver the project. So funding is always going to be a challenge, but hence we do a lot of collaborative working. So all of our research projects, we work with national organizations or research organizations where they value the input of community partners. This is what we bring. And then as a result, there's funding allocated to us as a community partner. But we don't shy away from the taboo-related subjects, which is what our communities don't want to talk about. We need to be creating conversations. We need to have more people in the community, the ambassadors as one, but we need to generally have more people talking about mental health, or the challenges around mental health, domestic abuse. Again, it's another area that we've focused on because of the pandemic, and we've realized that people have been suffering in silence and not getting the right support. And also the challenge is that the reason why we've created our community ambassadors is because the current services are oversubscribed, so people can't get a counsellor if they need one because of huge waiting lists. So we need to take the match into our hand and try and find a way of supporting people while they're waiting for that specialist support. And the other areas, we don't shy away. We will talk about subjects that people don't want to talk about. And I think working with yourselves, this kind of podcast is a great platform to get the stories out, because if we don't get the stories out and raise awareness, then we'll continue to be working in our silos and working, our community is going to suffer at the end of the day.
Yeah, absolutely. And I think that part of that also links to how we preserve these stories. A lot of work people are doing. So, say, for example, people like yourselves, you have been actually picking up issues and then kind of reflecting on it, and then putting some actions, rather than going into like much conversations. You have always practiced action. And I think that's one of the powerful things that we need to do, particularly when it comes to the less spoken of communities, and who are less vocal, or who has been less little representation on the social surface, I would say. And it is challenging at times, like you were saying, like the funding. Of course, that's where we want to kind of collaborate and work more and kind of build that in. But at the same time, I'm thinking that these podcasts, or this kind of platform actually helps us to reach out to many people, and that's what the purpose is. So if you from the health action, South Asian health action perspective, are you even thinking about doing any radio or anything that you are doing already?
Yeah, so thank you for, again, it was just lucky that we've got Eva FM, our local community radio station. And again, they approached me to say that, you're doing all this health work. How about doing your own health breakfast show? So for about 8 months now, of every Thursday morning from 8 till 10, I run a health breakfast show on Eva FM. And again, that was really to get, all of these health conditions, raise more awareness through the radio, but also to engage with that South Asian population who are tuning in at that time. And the other work we have to do is, as I said, collaboration is key, because we can't do everything, but we also need to ensure that collaboration and people who've got the same values and want to have the same goal, which is to ensure that we work for our communities. That's got to be the ultimate goal, and that's what we try and do. And as I said, South Asian Health Action, we're also supporting and growing other organisations. So we've got youth charity that we support, Ekiam UK, and we support other community organisations who, smaller support groups. So when we put our funding bids together, we try and ensure we put some funding in for each of the community networks that we're going to work with, so that they will be able to have a resource that they can use, but at the same time, they're going to bring us their kind of networks that we can work with and get the message out. So the collaboration is I emphasize that a lot. Collaboration is key, but what drives us is the passion. And if we're passionate, then we're going to get the right results. And the way I work is simple. If I see a gap and nobody's doing it, I will try and address that gap. And if it's, and if it's of knocking on various doors, or sometimes you have to be critically challenge some organisations because they're not, doing justice to our communities, then we have to do that. But ultimately, we still have to keep that good relationship with all of the networks, all the organisations, because ultimately, I believe we all got the same goal. It's just the pressures of whether it's funding or the pressures of the government policies or whether it's pressures of local institutions having to change the way they work. The only way they're going to change is if they have people like us and communities engaging with them to change the way they work.
That's right. And as universities, I think that we are also starting to look at that it's not the education that we provide inside the classroom, but it's also equally important that the students go out and work with the community to learn some experience. Because, of course, once they graduate, they are going to work with the community rather than in this bubble, which is kind of a comfort zone for them. So, in a way, like you were saying, that sometimes you need more people. Of course, if you don't have funding, you can't have people like on paid roles. But that's where the universities can also come in, maybe in the future, where our students can go. And then, of course, universities do have different ways and means of supporting the students as they gain their work experience. So that can be one of the things that you can explore in the future. Go here ahead.
Definitely, I think
Yeah.
the certainly the psychiatry students, the medical students, they're going to go and graduate, but their placements are very much institutionalized within that kind of medical area. What we're now trying to say to the hospitals who have got newly trained graduates, doctors, or even people coming into the new psychiatry field, is to get yourselves engaged in community organisation like ours. Volunteer your time. We do a lot of community events. You'll learn from these are the communities are you're going to be your future patients. So you need to understand how you can where they are, what they do, and how to engage with them. So yeah, no, you're right. I think it's the university. I think my background is health and social care. I've worked, I was the first Asian drug and alcohol worker here in Leicester, and worked in mental health, and then I work more in equality now and community engagement. But I think prior to yourself, I think we've not had, from the university point of view, we've had very little engagement in the community. So I think we need to look at the various departments and how we work closely with, those departments to work better with us in the community and also engage with us and work in collaboration, because otherwise we're going to keep working in silos and we're going to keep reinventing or duplicating work that we can. And the most important thing is if we can pull all our resources together, whether it's financial, whether it's skill, universities can bring that. We're not always looking for finances. We're looking for that expertise. So that's a skill which the university have, the resources they have that they could offer to the communities.
Yes, absolutely. And also, like I've heard quite a bit when I've started working with the communities that there is always a kind of fear for within the general community of coming into university. And I think that's something to do with what you were saying, that, lots of us have been actually in the city working in silos, and we have not. We have been very much disjointed rather than a joint effort. We have always looked into operating on, smaller but our own nation, that kind of thing. But post COVID, I believe that the intention and the purpose and all of that has been looked again, and somehow it has been it's changing gradually, I believe. And one of the things that I have been trying to do within the university as well, to have a team, a team that actually involves the community organizations who are working, and we kind of work together. Maybe we can just meet once 3 months, or however way is beneficial, but to support each other's work. So, say for example, if you have got a PhD researcher, like I was talking to you just before we starting, that I've got a PhD researcher at the moment thinking about gathering some feedback and doing some interviews with practitioners who are working particularly um, in the maternity section, and that's what one of the things that we are looking at. We have been also looking at, like you were saying, how does media represent, say, for example, different health issues, and how basically the South Asian communities, the challenges, the things that they have, that has actually prevented them from doing things as well. So all of that has been told in a particular way in the media, and I think that alternative platform is very much required, where we actually tell the real stories. Like you were saying, the stories are quite powerful. And in a way, we are trying to also capture that through an iMuseum project. Of course, one of our researchers who's working on the iMuseum is going to actually get in touch with you as well. So I've passed on your contact. So, all of these work that we are doing, what do you think that, the response has been so far from the community? Have they participated wholeheartedly, or they still kind of a little bit
So
worried?
yeah, no, I think the from the community aspect, because we've got a good network of community, whether it's temples, whether it's mosques, gurdwaras, whether it's community, people who have been working in the community for many years, who have got that reach. So that's the key, is that if the relationships that have been built over time is what leads to the success of what we've been doing. And secondly, look, we started 5 years ago, and our mission at the time was just to do one event for organ donation, one for diabetes. But then, we realized that all the other health conditions associated with them has a big impact on our community. So we needed to do more. And as we started to kind of collaborate, those are opening. So we're able to influence nationally, locally, regionally. And as a result, more of our people want to support us through funding, but through collaboration as well. And they see that we have got the reach that they don't have. They see that we are trusted within our communities, which is sometimes challenging for them. So that's where it's a win-win for both. We're trusted, we got the right messages, or people who can amplify that message better, whether it's in a linguistic way, whether it's in a cultural way, or whether it's just generally going to the right places where we need to engage in our communities. So from a community point of view, as I said, we live in the community, we are from the community that we serve, and we are patients or carers or community members from that community. So that's why our uniqueness of South Asian health was that to have that voice. And that's now hopefully people do recognize us, and we now use different mediums, as you said. So, the social media, our visibility has grown through our social media presence. So we've got a new website, which is sahauk.org, and that's our new website that we've just created. And then we've got other platforms where we get some of our volunteers to manage those platforms who are more better to do it. So Twitter, Instagram. I'm more used to Twitter, but the other kind of social media platforms like Insta or TikTok or whatever. So it needs that younger generation of people who can give that, and it's great. We now empower people to take lead on all of our projects. So it's not one or two of us. It's like we've got our ambassadors who can then take the lead on an area that they're passionate about. So and that's what we're growing all the time. And working with organisations in India, has helped us as well, because we're not reinventing. There's some really good culturally sensitive resources, whether it's on diabetes, whether it's on anxiety, depression. Why don't we just utilize that, bring them, give those packages to our ambassadors that we're training, or even to other organizations who would value that, because then it saves them from having to reinvent or try and produce new packages when there's already information or packages that they can use, or toolkits that they can try and then adapt it to meet their local kind of need. But it's still culturally sensitive. So I think that's what we kind of try and do, is not to reinvent, but utilize the expertise that's come back from from where we're from the South Asian background.
Yeah, absolutely. And I have seen the impact as well myself, isn't it? So, because we did that training with you, the mental health ambassador training that you did, and hopefully we will be running again. Like you're thinking of widening that, isn't it? More within the community. And it has been really beneficial because I've seen some of the people actually, um, handling cases differently, talking differently, trying to reach out more, understanding. And so I can see that, if we can actually train the community up, I believe that that also helps in breaking those kind of stereotypes or stigma within the community as well.
Very true. I think it's the conversations. If we can have the right conversations at the right time or with the right people that we want to engage with, then that's the way forward. And again, we are obviously our mental health ambassador program. We are seeing that as something that we're going to take forward over the next 12 months. We are kind of working with the local NHS around the reconfiguring the mental health services. So we are saying that they need to be more rooted in the community. The ambassador program is one initiative, but also I've always worked in a kind of a peer way or an ambassador way where we have the right people who can be the right messengers or the right people who've got lived experience, and I think that's gonna it's without the UK, sorry, but it's SAHA.org is our website, and look, anyone who wants to work in it with us in terms of collaboration or in terms of wanting to partner up on any initiatives, we're here for you, and we're here to do that because we don't. The more we can work in a collaborative way, joined up, we will reduce the element of working in silos. And our three key messages around: if your values and you're passionate and you're fit within our mission, then we can work together.
So is the one that I shared, is that the right one or not?
Just without the UK at the end, so it's
Without UK at the
saha.org.
end.
Yeah,
Okay.
yeah.
Yes. Okay.
Sorry,
Yeah. Okay. Because
sahauk.org.
in a minute, I'm going to also go through the website so
Yeah.
that our participants can also have a view of the website. So
Sorry, Indrani, it's sahauk.org. Sahauk.org. Sorry.
sahauk.org.
Sorry.
Okay.
Yeah. It's just a new one that we've just.
No, that's fine. Yes, it's just it has changed from the last one, isn't it? That's perfect. Got that here
That's the
now.
one.
That's the one, isn't it?
Yep.
So in a minute, what I will also be doing is sharing the website here, just for an overview, and you can talk us through a little bit where people can get some support, and if they want to get in touch, whether they want to do any sort of charity work or help you in any of the work, like doing volunteering work.
Yeah. So in our website, there's an expression of interest form that they can fill out if they want to volunteer. We are obviously fundraising is going to be our next strategy for over the next 2 or 3 years, and we are looking at working with people in the community who have doing various events like dinner and dances, or even walks or climbing Snowdonia. So they're the things that we're going to try and do more of, so that way we can get our communities to become engaged in all of our work, but also spread the health message as well as we're doing these initiatives.
I quite like the way you've done it. People have done it really good. It's the human circle in spiral, and it's very it has got a message in it as well, I believe, from how it has been structured. Any idea of how you actually did it? Is it more with the developer, they doing it, or you have been actually directing them to?
So luckily, it's a local developer who's very creative, and he's got his background is branding as well, and then we just he's been seeing our work for the last 2 years, and obviously he knew about our work, and then we just needed to help him with more of the kind of content element, and again it's always evolving. We've tried to kind of bring in some of the statistics of our what's been the outcomes, but as I said, we've got appeals like the kidney appeal that's on there. We've got a young doctor who's needing a kidney now, so we've just launched an appeal for him. We've got Paolo, who's locally again needing a transplant. And then we try and, as I said, collaboratively, our community partners are key, and we just need to keep adding. And we've got to add, your logo as well, because that's, we've been working with yourselves on that. But I think that
absolutely.
the website we tried to create was we want to get the lived experience story. So, people who've had a transplant, those who are willing to share and come forward, we will have them. And our next element, which probably we can work together on, is getting those case studies on a podcast, so we can have them on our website, so people can really engage with that person's story or their journey of whether they've been waiting for a transplant, or whether they've had a challenge around domestic abuse, or whether they've had a challenge around losing somebody or their own. And we've got some fantastic, case studies locally, nationally, and internationally that are willing to share their story, of wanting to come forward, because they believe if they don't talk and they share their story, others won't. It'll probably give others the opportunity or the motivation to come forward and share their story as well. So that'll be useful as going forward. So the website is really much still work in progress. We've tried to get it to an opportunity for anyone who wants to look into our website of the work that we do, and they will see, we can collaborate on our projects, and that would enable them to do that. So thank you for sharing our contact details as well, because that's kind of way we're going to increase our awareness of our organisation, but also increase the collaborative working within our communities. And we are, one thing I didn't mention, but we are going global as well. So we've just I'm leading on the UK Rotary International Club for Organ Donation. We've just chaptered a global club for organ donation through the Rotary International movement. So that's just been launched in June, and I'm taking the lead in the UK. So hopefully we'll get all the Rotary clubs in the UK connecting on organ donation and raising awareness within their community, and hopefully they could also raise some funding for local projects in their area that want to do work around organ donation or raise awareness of organ donation. So we are globally is what our kind of our ambition is, in terms of India and obviously working in the UK, but Africa as well. We've got links in Uganda, Kenya, and now with the Rotary movement, that's a global kind of platform that we're going to be working with. So we're excited about the next 2 to 3 years of what's going to happen with SAHA, but also with the work that we do to get the right messages out within our communities.
Absolutely. And I think that, the way you have also got the website, I think it's much more informative, and people can easily get in touch. So it's not very, hard to kind of look into the things. So like in the about section, you've got different section talking about your mission, news updates, community projects. So anybody in the community who wants to get involved, they can get involved, and they can also contact SAHA to share their story. And I think it's a very good idea, like you said, if we can actually set up something, maybe a day in month, every month, one day, that we you can come to the university with people, and then for the whole day we actually do a series of recording for SAHA. And our students also learn experience by talking actually with the people from the community, and then the community also feels more empowered by coming into the university and kind of using some of the facilities, I would say, as well.
That'd be great.
Which would be quite good for them. So altogether, I believe that that's a possibility that we can set up in the future. We can have a talk around that. But the other thing I was thinking of as well is that the volume of work that you have produced, I believe that we need to consolidate that at this moment as well, isn't it? To kind of get it out somewhere, saying that this is the organization who is working and what the work they are doing, and all of that, and more so from an academic perspective, I believe. So it would be good to set up a team of writers as well, where we get these small stories out, not just in the form of a blog, but also in the journal articles, because lots of journals actually accept small, short papers, because you have got more lived experience, and that's quite crucial. So what any student, whether they be medical student or they be humanities student, whatever they will learn inside the classroom is not practical in that sense. But when they are actually going into the community, like you said, that you're asking them to volunteer, that can actually be powerful and improve their delivery as well, within the community.
No, I think what you said is right, and that's what's been not a downfall, but just because of capacity or expertise. So
Yeah.
having, you working with the university through, we've had some students who have been doing journalism, and we've helped them to get the story, the case studies, so they could help them with their dissertation. But in terms of getting the work and the experience into journals, that's really, a great idea, and that would
Yeah, I
help us
think you've
to.
done that work, isn't it? You've done a volume of work now, which
Yes.
can be published,
Yeah,
in
so
that
luckily,
sense.
we've got a relationship with BAPIO, British Association for Physicians of Indian Origin, who have put some of their papers out and some of the work we've done. But again, it's still very much not many. It's not wider than So whatever we can do to get our vision or or work we've done and get it out there in a wider domain, which is really going to be a great idea, and how we can work with you to do that.
Just another question, really. Like, have you ever thought of actually going to the parliament, or with your findings and the things that because you know that where the gaps are, and you work with the communities regularly, so you know the problems. So, have you ever thought of going to the parliament or to the select committee to kind of talk about some of the changes in policies that they can make? Surely the community resilience is one of it, that I have been looking at, but I've not been looking at, you have looked at a variety of subjects, but mine was very much focused around community resilience. So I looked into that, and I see that there is a lot that we can do actually to influence that. So that's one of my areas of interest, where I will be again contacting you and see that as a community organization partner, whether we can do it together. But is there other ones as well where you think that there needs to be more work done or more effort put in?
Yeah, so I think it's a great idea in terms of the getting our work and into the various parliaments. I think we fed into national organisations who have taken some of the work we've done and presented it to address, the health inequalities, or working specifically with, South Asian communities. But we've just been a kind of a lay partner to that. So maybe that would be great to get South Asian Health Action actually presenting, our kind of work and the findings of. And I think this next 12 months, as I mentioned, the Health Inequalities Programme that we're going to be working on, that will be, a great opportunity to kind of, as we learn from that, to present that to various committees around mental health, whether it's around, maternity or hypertension, or even respiratory with the COVID, task force as well. So, there's a great opportunity to kind of make sure that we actually, gather and evaluate the work, and making sure that we feed back what the communities are saying to the relevant decision makers and policy makers, that will hopefully help shape future policies as well.
Absolutely, I think that's essential, and with the stories, you can definitely actually have an impact on that. Going to the community, sorry, going to the parliament. And I quite like the way you have also said here, like engage, educate, empower, and explore. And I believe that all these four pillars are quite essential when it comes to making a difference or making an impact within the society. And one of the things that we are also exploring is what is the purpose of the university. So you, as as an advocate, and as a very active, what I should say, a very active ambassador of everything really within the South Asian community. What do you think is the purpose of the university is in this? Like, what should be the purpose of the universities, do you think, from your perspective?
I think you've throughout this session today, or presenting what we do, we've identified lots of gaps where the university, as a big institution in our city, could help, and the research, the funding in terms of collaborative bids, help us with some of our bids, getting volunteers to grow our volunteer base who want to do back in the community. Even when we did our initiatives around organ donation, we do, with the National Hindu Students Forum Network, we've developed some partnership work. But and we've had good links with De Montfort and Leicester and Loughborough University Hindu societies. But again, we could be looking more working with those societies in the universities who are actually would be interested in championing some of the projects that we work on. So I think there's a lot of scope for the universities to be involved and support. And it also, the university is in the community. They get people from our communities coming to study it for 3 years, maybe 4 years, maybe longer if you're going to do the medical kind of degrees. And so we've got 5 years of potential people who are going to be in our city, coming from all walks of life, all other areas. That's a great way of the university and community organisations partnering up to provide that kind of reach in the community for those students to get that rich experience of what it's not just living in a city and coming to the university and studying, but being part of that community, so they feel when they do get qualified they've had that rich experience of being and living and breathing and walking the shoes of some of the people that they're going to be working with.
Yeah, yeah. And I think that that's where we need to rethink a little bit about, how we engage, what we do. Like you were saying, these 4 pillars. I believe that as universities, we need to also kind of think about, what's going to be the mode of education. How are we going to empower the communities? How can we explore the future possibilities and all of it? Because, of course, there are many more challenges going to come. You've got all these conversations around metaverse, which has started, and and we just don't know where that's going to take us. And of course, the metaverse will have a long-term, again, mental health impact, I believe, because the younger generation is going to get sucked into it quite a bit. So we don't know really, but I think that the works that you're doing, it's sustainable in a way that you have connected with different organizations, and every year you have expanded, and I think that that's amazing. That not many organizations will have that, and as you say, that's quite clear that it's from your passion that actually keeps you motivated and keeps you going. So, would you, in the social media age, of course, being an influencer is one of the very many things. Would you call yourself as an influencer?
Yeah, I think it's an influencer, but also partly it's about an empowerer to kind of get people to understand that their voices are important. So, it's, if I can influence the institutions or even the charities, the medical charities, which is what we do a lot of. We try and say to them, what is your reach within the South Asian community? And sometimes they're challenged because they don't have that reach. So we can influence the way they work. We can also empower them to reach better in the people that they're trying to engage and serve. And then by having that relationships, we can get them involved in the research that their current challenges are we have. So I kind of do, I influence, I engage, I kind of empower, but most importantly, I like to, I call myself a troublemaker, because I try and, if the doors are closed, I will try and make sure that they open, and that's the way we've had to work, because we're a niche in terms of the community that we're trying to serve. But in Leicester, the South Asian population is huge. In other big cities where we've got high South Asian populations, we shouldn't be a minority anymore. We're actually the majority in some of the cities. So that should reflect in terms of going back to the universities and the NHS hospital structures. We need to ensure that we have people from our communities, from South Asian communities, on the boards of these institutions, because otherwise, there's a lack of diversity already on institutions in our own city. And that's what I also try to, coming from an equality background, I want to ensure that the diversity represents the population it's serving, and the institutions also should be reflective of that. Again, we can only do that by working with institutions to get more people from our communities represented on boards, on the workforce as well. That's another area. We need to encourage our younger generations who have studied in your universities to think about coming back and working in the institutions as well, should they wish to. So I think that's kind of really the richness of what universities can do, but we can only do that if we work together and collaborate and most importantly, be transparent, but be honest about where your challenges are. And that's where, if we're honest, we can have that honest, constructive way of working. And that's the way we've got to go forward.
That's very powerful message, really, and I think that you're right in saying that, because I was talking to one of the colleagues, and they were saying that they won't like their kids to grow up in the city is fine, but then after that they want them to be in somewhere else which is much more better. And my question is really, I mean, Leicester has so much potential. Leicester has so much, Leicester is so much unique in its way, because of course we have got this multicultural society which brings in different expertise and everything, but however we have not fully utilized that, and possibly collaboration is the key, and we have to take that forward, I believe. But it's been wonderful afternoon speaking to you indeed, and we will keep working. And I think that what we will do is we will have a plan, I think, going forward again, like we did last time, and then we'll take it from there. But thank you very much, and I hope that all the work that you're doing, it not only you became you become successful in that, but also more and more of the community people get benefited from your projects, and that's going to be really remarkable for the society in general.
Thank you again for this opportunity. And again, I think your idea was great in terms of having, either monthly or bi-monthly kind of regular, and bring some of our lived experience members to kind of share their story, because that's going to be really powerful. So, and yes, and the listeners who are tuning in today, we are here. SAHA is our organization. It's, for you. So let's work together to make sure that our communities get the right support, the right services, and most of them get their voices heard.
Fantastic. So thank you very much again, and thanks to our audience as well. If you're watching now, or if you're watching later, I hope you all can you can see the website of SAHA on YouTube now, but also, sorry, sharing the wrong one, but also the WhatsApp number and the support at sahauk.org email address. So please do get in touch if you want to, if you're looking for volunteering, or if you are looking to support SAHA in any ways, or if you want to get supported by SAHA. So in any case, get in touch. Thank you very much, Kirit, for coming to us and talking to us.
Welcome. Thank you.
Thank you.